Welcome everyone to our annual meeting and our phased reopening task force update. We're excited to come to you over Zoom and just provide a little bit more of an update regarding what our task force has been up to. The last time we presented and shared an update was at our last My Church gathering. And so a lot has changed in the world in COVID. So we're eager to share some more information with with all of you, with our church. So I am joined today with Dr. Nate Chomolo. Dr. Nate, do you want to introduce yourself?
Hello again, Sanctuary. Dr. Nate Chomolo. I'm a pediatrician and internist practicing in Brooklyn Center. Been a member of Sanctuary for over 10 years. Attend with my wife, Jenny, and our son, Inchare. And I'm also the medical director for the state of Minnesota Department of Human Services. And so helping provide with the rest of our team kind of the health and public health guidance for our community. Happy to be here.
Yeah, thank you. And Dr. Nate, we're so grateful that you're part of our task force. You provide just wonderful insight and experience. So we're grateful for um, all that you bring to our task force. The rest of our task force includes also Andrea Lee. We co-lead that together, this task force. And then Elder Vida Kent, as well as Jim Koch, and then Alana Hinkston. This makes up an incredible task force, and we've just been so grateful for these group of people. So again, today we're here to provide a little bit of an update. So just as a refresher, the purpose of the phased reopening task force is to develop and to implement a phased reopening approach to best ministry practices during the pandemic of COVID-19. And so we're just hoping to, as a task force, have an incremental step toward the way in which we regather together, because it's not as simple as just gathering together in smaller numbers. There's incremental steps with a church our size and in a ministry context that we're in, that we're striving to do in this time in a wise and discerning way. But I do want to say at the very front, at the very beginning, that this is not easy. It's not an easy time. It's not an easy season. None of us are, happy about the situation and the fact that we can't be together. It's difficult. It's difficult. You might think that, church online would be easy for our staff. We just go in and record something, but it's difficult. It's really hard. It takes more work to do all of this online. And so we wish that we could be together. We wish that we could be gathering together in worship on a Sunday morning, in life groups, in Royalhood and Mosaic, and serving our community. But we also take very seriously the command that Jesus gives us to love one another. And that means protecting each other during this pandemic. And so I want to say clearly that we wish the circumstances were different, but they aren't. And so we are making these decisions with the information that we have, as well as the current conditions. So that's our purpose as a task force. And then Dr. Nate is going to share just a little bit about our phased reopening approach and what each phase looks like.
Yeah, thanks, Pastor Rose. And so just as a recap from what we laid out earlier this year, we have different phases that the task force discusses, and recommends to Pastor Rose and Pastor Edrin and the rest of the leadership about moving through them based off of what we're seeing in the community with the spread of COVID. And so phase one was what we were doing immediately when the lockdown began this spring with all online worship and ministry. And then phase two was moving into the summer when we were able to do some approved small group in-person ministries, but continue to do all online worship. Phase three would be all online worship, but more and continuing some of those small group in-person activities, but then some also staff-led mid-size in-person meetings. So things like inviting guests to Wednesday night recordings or leadership trainings. And then phase 4 would be an outdoor service with some limited pre-registered attendance alongside a live stream option. And obviously this is weather dependent, though it is seasonably warm for December right now. And then phase 5, 2 indoor services, or moving or transitioning, I should say, to 2 indoor services with some limited pre-registered attendance alongside the live stream option. And again, this is a way to better plan out where people will sit, making sure we don't get to capacity, so it could really decrease the risks of that indoor service. And then phase 6 is a return to full capacity attendance, back to a lot of what we would say would be normal before COVID-19 hit. And so we wanted to, as a task force, kind of take you through some of the things we discuss and when we make these recommendations to leadership at Sanctuary. And so what we usually do is start our meetings by talking about, well, what is the current levels we're seeing in the community? And as I believe many of you are aware, we are currently in the midst of another surge, and in many ways, the worst surge of the COVID-19 pandemic thus far. And so we usually start by looking at things like test positivity rates. And so if we look at last week, our test positivity rate statewide was 7.7% and 8% in Hennepin County specifically. And the kind of number that in general we are aiming for as a state from a public health guidance lens is 5%, less than 5% for test positivity rates. And so we're well above that right now. The other thing is we look at more specifically at Hennepin and what's going on in Hennepin County. And so one way to do that is looking at the case rates. And so how many people have been infected per 10,000. And so for reference, when we met in October, the number was 23.5 per 10,000. And this week, it was 122.8. And so a pretty significant jump from even the fall. And with increased cases, we see increases in hospitalizations and ICU admissions and even deaths. And that is what leads to a lot of the real concerns is that there's more likely to be community spread. And then if you do get sick, our healthcare system is being stressed unlike any other time. And so there's just increased risks if you were to enter the healthcare system itself right now. And then, a couple other things that we talk about is, looking at, well, who's actually getting infected. And so if you look at the proportion of cases in the state over the last week, it's actually highest for those who are underneath the age of 60. And so we're seeing more cases in those who are younger. But when we look at the proportion of deaths are highest for those over 60. And so when we have, particularly when we're thinking about bringing together a community that's really intergenerational, that's really something to keep in mind as well. You likely have heard throughout the pandemic that if you look at what we call age-adjusted rates, which is a way to just look at populations and compare them a little more accurately, we still are seeing disproportionately high rates of COVID-19 for Black Minnesotans, Hispanic, Indigenous, Asian, and even multiracial Minnesotans when we look at the rates versus white communities in Minnesota. And so given our multi-ethnic, diverse community, that's another thing we need to keep in mind. And then the way it's being spread. And so right now in Minnesota, it's predominantly in the community, and but there's also about 40 or so % of spread is unknown, meaning we don't even have a good idea. Some of that's just because of the ability to actually track it is so stretched thin right now. But when it's not known how it's spread, these type of larger gatherings increase in risk, right? And so those are many of the data points that we will talk about and kind of talk about in the context of our community, and can again continue to weigh the pros and cons and of what the impact is and how we can continue to live and minister amongst our population and amongst our community. And so, with that, earlier in the fall, we were thinking, well, maybe if things continue to improve, we could talk about moving to phase 3. But given the surge, it's actually more consideration of moving backwards, which is what this kind of dial up and dial back approach is really allows us is when we see things change is given recommendations to reflect that again to keep us safe. And so always welcome any questions and any concerns anyone in Sanctuary has about these discussions. And at this point, I'll turn it back to Pastor Rose.
Great, thank you. That's so helpful. And I do want our congregation to know that every time we meet as a task force, we're asking at the very beginning of our meeting, are we ready to move into another phase, especially moving up, because we want to get back to normal. And we were at one point ready to move into phase 3, but with the surge, we, of course, saw that it wasn't a safe choice. So back in the summer, our task force asked the congregation to take a survey. We wanted to understand what you were thinking and feeling about the pandemic and gathering together, especially as a faith community. And then also we wanted to know how you're doing, what you needed. And so in this congregational survey, we got some great feedback. A lot of it really confirmed what we already were assuming were some of the sentiments of the congregation. But some of those high level findings of the survey showed that over 60% of our congregation stated that it would be very unlikely that they would attend in-person worship services at this time. And again, that was back in the summer. And so likely we could assume that that number has increased. That's certainly just a guess, but I think probably an educated one for sure. Then also members were overwhelmingly sharing a desire to continue in online worship during the spread, whereas new attenders were more likely to share a desire to come to a smaller in-person worship service. And so we saw that interesting delineation between our members and new attenders. And then the age distribution was really what we expected, that our younger congregants were more likely to meet in person. And of course, that became less likely as the age increased. And again, that's not something that was a surprise to our team. And then overall, we are all feeling the tensions right now. COVID-19 is not an easy season. And so many of us are feeling disconnected and we want to be together, but we heard from many of you that you're staying encouraged despite all of this season holds, that you are engaging in online worship and other formational opportunities, which this is exactly what we hope, is that you will take advantage of the ministry opportunities that are still happening, even though we're at home more. And that we just want to encourage you again to stay connected, stay engaged in those opportunities. We have lots of ways that you can get connected, and we don't want you to feel the unduly isolation in this time. There's already isolation, but there are ways to connect. And so if you have questions about that, please reach out to us, whether that it's pastoral care or questions about the task force. You can connect with me at rose@sanctuarycov.org. I'd love to get you connected in any way that I can. And then just a few other updates from our task force. We have been working hard, even though it seems like maybe we're not, because we're still in phase 2 and it's been a while in this phase, but we have been working on lots of things right now. Some of that includes compliance. You wouldn't believe it, but it takes a lot of time and a lot of communication and training to ensure that we are all in compliance in this phase, because that's building a strong foundation so that eventually we can move into other phases. And so Andrea and I have been working with all of our staff. We've been working with volunteers to ensure that we have compliance across the board, across ministry areas, ensuring that we have the same check-in process, that we have systems and structures in place to support this phase that we're in. And so you can be assured that we're doing work in that way. We're also looking at, adjustments as the restrictions have changed in the last few weeks. That means, Andrea and I are listening to the governor, and as soon as we hear these updates, we're strategizing together. What does this mean for our staff? What does this mean for our ministry areas and recordings on Wednesday nights? We take all of that into consideration um, with each new adjustment that's been happening recently. And then we've also installed the recommended air filters within our HVAC. And so that happened in the fall. So that ensures that we're compliant with the city. And so those have been installed and they're working now, which is great. We also have some, we put in the budget for 2021, some fogging that might happen either monthly or every other month. As we do eventually meet together, if we need to kind of sanitize the whole church, we're able to do that now with the budget. And then we're continually, as a task force, assessing whether we're ready to move into phase 3 or make adjustments in this current phase. One thing we've been doing as a staff team, as a pastoral lead team, is looking at each phase and what kind of micro phases are within that phase, because we won't jump into phase 3 and it will be, the full-fledged phase, but there are kind of incremental phases within that. And so we've been strategizing around that and working with staff to ensure that we develop a process toward full reopening. So we've been working with our directors, for example, like in Royal Hood, what does Shayla need to be doing from right now to ensure that we're ready someday to have children in our Royal Hood classrooms again? How will check-in and classroom ratios change? I mean, there's a lot of adjustments that need to be made. And so we are making those, we're doing that work right now as a staff team. And then finally, of course, we're providing pastoral care and resource support. And I want to extend an invitation. If anyone is in need of pastoral care, if there are resources that you're in need of, please reach out. Do not suffer alone in silence. We want to know what your needs are. We want to be walking alongside you in this time. And so please reach out at care@sanctuarycov.org, and we would love to connect with you around any of your needs that you might have in this season. And then that is the our full update from the task force. Again, we're so grateful that we have just a solid task force thinking critically about these things. I personally am very proud to be a part of Sanctuary Covenant Church that takes this seriously, that strategizes across many member gifts. I mean, I love the fact that our task force includes a diverse group of people who are thinking about this critically, but also in alignment with our faith. This matters greatly. This is a theological question for us. How do we live out the values of our faith? And so I'm just grateful for all of you and just really hope that you stay healthy and stay safe in this season. So again, if you have any questions, we would love to connect with you. You can email me at rose@sanctuarycov.org. So with that, be blessed and be safe and healthy, Sanctuary. Thank you.
Stay safe.